Let me take you on a journey through the intricate dance of life's symphony. Picture vitamin K as the master conductor, skillfully orchestrating the delicate balance between clotting and bleeding. But what happens when this maestro goes missing? Our performance falls to disarray, leaving us vulnerable like a ship adrift on stormy seas. Don't fret though, with the right treatment and nourishment, we can steer our vessel back on course, restoring the harmonious rhythm of wellness. So join us as we explore the captivating world of vitamin K deficiency and discover how to reclaim the steady beat of health. Welcome to Vitamins, your ultimate guide to holistic health and wellness, offering expert insights and practical tips for optimizing your well-being. As a quick medical disclaimer, the content we offer is for informational purposes only. Please consult with your doctor for any questions regarding vitamin or supplement consumption. Now let's get started. So there are two main kinds of vitamin K, vitamin K1, also known as phyloquinone, and vitamin K2 or menaquinone. Vitamin K1 is mostly found in plants, especially leafy green veggies like spinach and kale. On the other hand, vitamin K2 is naturally produced in our intestinal tract and works in a similar way to K1. Now, why is vitamin K important? Well, it plays a crucial role in a process called coagulation, which is basically blood clotting. This process helps prevent excessive bleeding, both internally and externally. When you have enough vitamin K, your body can produce the proteins that are essential for blood clotting. However, if you're lacking in vitamin K, your body won't have enough of these proteins, and a common sign of deficiency is excessive bleeding. Apart from its role in blood clotting, scientists also believe that vitamin K contributes to the growth and maintenance of healthy bones. However, they are still studying this relationship to fully understand it. Fortunately, vitamin K deficiency is relatively rare in adults. This is because many of the foods we consume provide us with sufficient amounts of vitamin K1, and our bodies can produce vitamin K2 on their own. Moreover, our bodies are quite good at recycling their existing supply of vitamin K. Nevertheless, certain conditions and some medications can interfere with the absorption and production of vitamin K, leading to a potential deficiency. On the other hand, vitamin K deficiency is more commonly seen in infants. In fact, it has its own name, VKDB, which stands for vitamin K deficiency bleeding. Infants are more susceptible to this condition, and it's important to ensure they receive adequate vitamin K supplementation to prevent any complications. When it comes to vitamin K deficiency, the key symptom to watch out for is excessive bleeding. It's important to note that the bleeding can occur not only at the site of a cut or wound, but also in other areas of the body. Some signs of excessive bleeding include easy bruising, the appearance of small blood clots beneath the nails, bleeding in the mucous membranes that line the inside of the body, and passing stool that is dark black, almost like tar, and contains some blood. In the case of infants, doctor may identify vitamin K deficiency if they observe certain signs. These can include bleeding from the area where the umbilical cord was removed, bleeding in the skin, nose, gastrointestinal tract, or other parts of the body, and bleeding at the site of circumcision in male infants. One particularly dangerous and life-threatening consequence of vitamin K deficiency in infants is sudden bleeding in the brain. Now let's talk about the causes of vitamin K deficiency. Although it's not very common in adults, there are certain factors that can increase the risk. For instance, individuals who take coumarin anticoagulants, which are blood thinners, may be more susceptible to vitamin K deficiency. These medications interfere with the production of the proteins involved in blood clotting, which can disrupt the balance of vitamin K in the body. Additionally, certain antibiotics can have an impact on vitamin K levels. Some antibiotics can reduce the body's own production of vitamin K, while others may decrease the effectiveness of vitamin K in the body. Another potential cause of vitamin K deficiency is fat malabsorption. This can occur in individuals with conditions like celiac disease, cystic fibrosis, or disorders affecting the intestines, liver, gallbladder, or bile ducts. When the body is unable to properly absorb fat, it may lead to a deficiency of fat-soluble vitamins like vitamin K. When it comes to newborn infants, they're at a higher risk of vitamin K deficiency for a few reasons. Firstly, breast milk is naturally low in vitamin K, so exclusively breastfed infants may not be getting sufficient amounts. Additionally, vitamin K does not transfer efficiently from a mother's placenta to her baby, further contributing to the risk. Moreover, the liver of a newborn baby doesn't efficiently utilize vitamin K, and it takes a few days for them to start producing vitamin K2 on their own. When it comes to diagnosing vitamin K deficiency, your doctor will start by gathering your medical history to assess if you have any risk factors for becoming deficient. These risk factors often include taking anticoagulants, being on antibiotics, or having a condition that affects fat absorption. To determine if a vitamin K deficiency is the cause of your symptoms, your doctor will likely perform a coagulation test called the prothrombin time or PT test. This test involves taking a small blood sample which will be analyzed to measure how long it takes for your blood to clot. A skilled healthcare professional, such as a nurse or lab technician, will use a small needle to draw the blood sample. They will then add chemicals to the sample and observe how it reacts. Normally, blood takes around 11 to 13.5 seconds to clot. If it takes longer for your blood to clot, it may indicate a vitamin K deficiency. In some cases, the lab may also interpret the results using a measure called the International Normalized Ratio or INR. The INR is a standardized scale that allows for comparison of results across different laboratories worldwide. A normal INR typically ranges from 0.9 to 1.1. However, for individuals taking blood thinners, the target range will be around 2 to 3.5. Your doctor will assess if your INR value is too high, which can be an indication of vitamin K deficiency. The primary treatment for vitamin K deficiency is phytonadione, a form of vitamin K1. It is usually prescribed as an oral medication, but injections under the skin may also be used. The dosage for adults ranges from 1 to 25 milligrams, with smaller doses for those on anticoagulants. In newborns, a single shot of 0.5 to 1 milligram of vitamin K1 is recommended at birth, with higher doses if the mother is on certain medications. It's important to follow your doctor's instructions and attend regular checkups for proper management of vitamin K deficiency. Now let's talk about the long-term outlook for vitamin K deficiency and how to prevent it. In adults, if left untreated, vitamin K deficiency can lead to dangerous excessive bleeding. However, the good news is that almost all cases of vitamin K deficiency are treatable. In the case of infants with VKDB, if it's identified and treated promptly, the outlook is generally positive. However, if the bleeding, known as an intracranial hemorrhage, persists or remains untreated, it can result in brain damage or even death. To prevent vitamin K deficiency, there's no specific recommended daily intake. However, on an average day, nutrition is considered around 120 micrograms of vitamin K adequate for men and 90 micrograms adequate for women. Certain foods such as leafy green vegetables are rich in vitamin K and can provide you with the necessary amount in just one serving. For newborns, a single shot of vitamin K at birth can effectively prevent any potential issues. Individuals with conditions that affect fat absorption should consult with their doctors about taking a vitamin K supplement and having their levels monitored regularly. The same applies to individuals taking anticoagulants. Understanding the vital role of vitamin K in our bodies is crucial for maintaining overall health and preventing complications related to deficiency. Whether it's ensuring an adequate intake through a balanced diet or addressing risk factors and seeking appropriate treatment, we hold the power to keep the symphony of our well-being in perfect harmony. Let's embrace the significance of vitamin K, navigate the waves of knowledge, and empower ourselves to live life with confidence, knowing that we have the tools to support our bodies and keep the rhythm of wellness alive. Which dietary sources of vitamin K do you incorporate into your daily meals? Unlock the path to a healthier you and join the conversation by sharing your thoughts in the comments below. Don't forget to subscribe and click the notification icon to stay updated. Thanks for watching, and we'll see you on the journey to wellness.